Okay, Sarah, do you want to introduce yourself and then start?
Hi, I'm Sarah. I live in East Sussex. I'm 47 and I have a team of 9 PAs who work a mixture of full-time, part-time and casual hours. And I've been a PA employer for 25 years. Um, and today I'm going to be talking about, um, talking as somebody who is aging, like we all are, with a long-term condition, and how my PAs are essential not only for practical support, but for dignity, independence, and identity. So, as we get older, things definitely change, and maybe a sooner than most people with when you have a long-term condition. So for me, that means my stamina is lessening. Um, it takes me longer to recover from activity, and small tasks can suddenly become more like sort of climbing a steep hill. Um, so, for those of us who already have a disability, those changes have been more intense. Muscle weakness increases, fatigue, pain. So, aging with disability isn't the same as simply getting older, in my opinion. Um, an example um, is when I have long days out. Um, I've started now to take two PAs with me because it's there's too much and it's too takes too much of a toll on me as well. There's more things to do. Um, the order is more essential, and we have to make sure we clear schedules after as my um, tiredness increases. That's physical and mental. Um, and we have to prepare a lot more for more eventualities as well. Mm. So, um, having a PA means I can live my own life on my own terms. And it's not just about getting dressed or getting to appointments. It's about staying me. Um, so, um, a good PA doesn't take over. They make it possible for me to stay independent, to keep my identity as whether that's as a volunteer, as a daughter, a sister, auntie, or a friend. So I'm not a person with a condition. Um, when a PA helps me maintain my routine, my work, my social life, they're not just supporting my body. They're in a way they're helping me protect my freedom. Um, an example of that recently was when I went on a much needed break, um, just visiting in this country, and I hadn't been away, I realised, for 7 years, and in the preparation and planning, it occurred to me how much had changed and how much more there was to think about now that my condition had progressed. Hmm. Um, so, talking about needing more help, um, accepting we need more help isn't always easy. Hmm. I think many of us spend a lot of our lives striving to be as independent as as possible, and that might be working, hmm, managing day-to-day life, traveling, spending time with family. Hmm. So when we need more help, it can feel like a loss of independence. For me, that I saw that when I had a sudden decrease in strength in my right arm, and I'm right-handed, so I'd rely on that arm to do a lot of things, and my left arm is even weaker. So for me, that was a sudden loss, and it was hard to navigate and change the way I did things. Well, it could be a more gradual change, like the dexterity in my arms and the stiffness in my arms. And so something like cutting or painting my nails was something that I always took pride in. But then I found that I had, if I asked somebody to help me with that, then it actually was turned into being a help. Um, so I just sort of had to not be so stubborn. And also, I didn't want to risk injuring myself, so the balance shifted there. Hmm. But what I've learned is accepting more support or delegating tasks because I'm tired or weaker isn't the same as losing control. Um, it is an act of trust, and the trust takes time to build up. Um, but a PA can make that transition easier. It's in the way that they communicate, that they respect my privacy, and they wait for me to ask or for me to consent to help. Hmm. All those little things tell me that I've still got a choice. And somebody who loves crafting, and um, I've come to realise that if I don't do all of it myself, it's still something I've produced. It's just that I've delegated a task that's maybe more difficult these days to somebody else, but it doesn't lessen the fact that it's still my creation. Um, okay, so the best working relationships that I've had with my PAs, they don't feel one-sided. Um, it's not just a case of they support me. We definitely work together. Mm. There's always a certain level of professionalism, boundaries, of course, but there's also a deeper um, understanding and mutual respect. My PAs know when I need help often before I ask, but they also know when to step back and let me do something for myself if I can. Um, so that balance is crucial. Um, good example of where I've been glad that they've taken over and used their instincts was when I was in hospital for a week-long admission, and I was busy dealing with why I was there, and I was extremely tired and overwhelmed. And they just all rallied and knew when to do things that would just take that stress away from me. So that was when they sort of used their knowledge of me and my um routine, and just made it a much better experience. Hmm. So for me, uh, fatigue and reduced strength are the hardest parts of aging. Um, I can still think sharply. Well, that's debatable sometimes. I think I'm increasing brain fog, but physically, I'm losing abilities sooner, and I don't recover as fast these days. Mm. That means that I rely on adaptations. I've got more in the way of equipment. We have to build flexibility into schedules, and I have an environment that fits me, not the other way around. So my PAs help me manage energy wisely, and they do sensitively remind me to rest before I get too tired to pace myself or to stay realistic without giving up what I want to achieve. Um, an example of that for me was when I had a long day in London. We travelled by train, and hmm, I think we both, excuse me, hmm, we both knew that I would be exhausted by the time I got back, and there was still a long sort of routine of getting out of my wheelchair and to bed. And so my PA suggested that because I had the equipment with me, it would be perhaps a good idea, energy saving, to cut my tube feed on the train, which was something I hadn't thought about doing. But she made that possible, and I was really glad at the end of the day that we didn't have eating or tube feed to factor in, and I could just concentrate on doing the basic routine and resting and going to bed. Um, so there's definitely an emotional layer to all of this. And there are days when I feel proud, I feel capable, organised, independent. But there's other days when I do get frustrated. Um, when I sort of the little things that make me realise I can't do what I used to do. Um, that's where the emotional intelligence from a PA make a real difference. Whether it's a quiet word or just like an in joke or some humour, um, or maybe just sitting in silence. And if those things can matter more than you might realise, and sometimes it's not always about doing something about it. It's about being present as well. Mm. So I still love to do my voluntary work. I still want to contribute to work on projects, share my experience, but I've had to learn to do it differently. And my PA is a key part of that. Um, my team are a key part of that. They help me manage the practical side, getting to places, staying organised, but they also remind me that rest is an important part of being productive. Um, Without their support, I would struggle to find that purpose and to be me. And with it, I can keep doing what I love doing. Um, for example, I think going to the recent Pathfinders campaigning events, and that was achievable because I was able to take two PAs with me. We'd prepared well, we contracted in the fatigue levels, and um, that went like a dream. And that was, thanks to the teamwork, talking to each other, and it was it was a real success. So, what I hope you can take away from my experience is that my PAs provide the foundations that give me the ability to choose, um, to choose how I live, where I go, what I do. Um, Secondly, that trust can take time to build up. Um, and although also change because although often essential, um, accepting it can take a bit of getting your head round. Uh, for me, it certainly did. And finally, the PA's presence can help me to continue being myself, um, so that I'm not defined by those functions I've lost, but by what I can still give. Um, Getting older can feel like there are less options, when you have a disability. Um, but with the right support, with the kind of care that respects choice and building a partnership, there are always positives. My peers don't just do tasks. They don't just provide care, but they help create my independence. Thank you for listening.
That was brilliant. Thank you so much, Sarah.
I,
You can now breathe.
I
Um,
didn't smile very much there.
no, no,
I,
you've done fabulously. I am
I tried
going
to myself. It was
to,
horrendous.
It wasn't brilliant.
it was
Thank
brilliant.
you.
I'm going to unpin you and then pin Sue. Hi, Sue. If you'd like to introduce yourself and then you can share what you'd like to.
Okay, so my name's Sue McCallum. I've been a personal assistant for Sarah for around 16 years now. She employs me as well. Um, and I suppose the first thing to talk about is my role in working with Sarah, which is just daily life. It's what anybody would do in their own daily life. And I think the key part of my role is the word assistant. I assist. I assist in anything Sarah wants to do, um, from um, personal care to shopping to days out to family occasions, holidays, um, and anything you would normally do in your normal life. Um, so I've been with Sarah for, as I say, 16 years, and we are both getting older. It's inevitable. It happens. We can't resist it. So it's a journey we are both doing, but obviously Sarah has changes also that um, we are aware of. And they happen slowly. I wouldn't say they are a sudden and obvious thing. There's things that, we notice happen in some of the maneuvers we do. It might be more difficult to for Sarah to become comfortable. Um, so it's about adapting, asking, is that comfortable? How can we do this a bit differently, to make sure that this process still works, that you become comfortable, and that we're able to um, find a routine or a maneuver that works for us both. Um, Sorry, I'm going to have a look at my notes.
No,
Um,
absolutely.
I suppose, yes, like Sarah mentioned, a good example, it was um, our small holiday that Sarah had, which was fantastic. And one of the issues was tiredness, that, we'd had a very busy week, more so than a normal week at home. And there was a day in particular where Sarah was flagging quite a lot, and we had a discussion, Sarah and myself and her other PA, and Sarah realised that actually, realistically, pushing herself to do another day out was just not going to do her any favors, and actually a down day, a quiet day indoors was actually really nice. It was in a beautiful place. um, so we took a recovery day, but with the option of getting up, jumping in the car if we wanted to, if she felt recovered. But it was about being realistic, and facing the fact that there's no point Sarah wearing herself down to a point where she was going to struggle to re-energize, and it taken the edge off of a nice holiday. So those discussions are really important, I think. Um, I I wouldn't I wouldn't be afraid to say to Sarah, do you think maybe a rest day? She can say, no, I'm up for going out, and that's fine. But I'm not afraid to make that suggestion. And Sarah is more than happy to hear us make useful suggestions because we know her very well. Um, uh, so the other thing, of course, is emotions. With Sarah, I I can imagine, and I know from what she said that changes in herself can be quite worrying. She, I've known Sarah be quite sad if she thinks something has changed in her health and or maybe her stamina. But usually we can combat it by we talk. Sometimes it's just time. We find different ways to do things, and we always progress through it. We always find a way through, a different way to do things. Um, we can, for instance, we can use if Sarah is particularly tired and like she mentioned a day out in London and on the way home, the prospect was to have to come home and have quite a lot of work to do to get Sarah ready for that evening. And we was both running on empty. Now it's easy for me to eat a sandwich, but for Sarah to have a meal when she's already tired would be quite an exhausting process. So we suggested a peg feed, which was an instant hit of energy and powered her through the end of the day. She was able to come home and prepare for the evening with energy, just because, I had suggested, shall we try the peg feed because we've got time? And it worked really, really well. So I think it's good to not be scared to make a suggestion with an option. Would you like to try that? Yes, yeah. Sarah can say yes or no. I wouldn't ever bully her into doing it. Just for instance, I wouldn't think, oh, it'd be easier for me if Sarah has that now, because then I won't have to do a meal when I get home. But it's always ball is in Sarah's court. Would you like to do that? Will that help? Another factor, I suppose, is the emotional um, process for Sarah, accepting something new, accepting a change as she ages. But I think Sarah, a lot of her PAs are older, and we are changing as well. So we can, in a way, we can relate to the fact that we don't stay the same. Things do change in our lives with our health um, in a different way, but we all have to accept change. So I think that gives us a little bit of empathy on how it feels to have to leave something behind, something of who you were, but to also know that you can move forward in a different way and continue. Um, what else can I tell you? Yeah, I can't really pinpoint anything else to tell you. I could say as a PA, um, if you start in the role, you will need to allow time to get to know your employer. It is quite a process. You'll know what their limits are mentally, emotionally, physically, along with all the practical day-to-day tasks, what they like, what they like to do, how much energy they've got. So I would say always allow time to grow into that PA that will be effective, and crucially listen to what's being asked of you. Talk if you're worried about what you're doing. Is it correct? Um, and ask if you think, well, my employer looks a bit tired. Ask them, are you tired? Do you need a break? Just communicate as you would want done for you in that position. I think that's probably my best advice and my angle on the role. I hope that's helpful.
No, that's wonderful. Thank you so much. That was really great to hear your insights. And it is true. when we have long-term PAs, we all age together. We all age together. So I agree that that does have it gives a level of empathy and camaraderie that we laugh at each other.
Oh, absolutely. Yes, forgetting things and yeah, definitely forgetting things.
Brilliant. I'm going to pause the recording. Recording back on. Our first question is, what's the best way to bring up changes I've noticed in my employer's stamina or mobility without sounding patronizing?
Okay, so that's probably a question for me.
Yeah.
I think we just bring these things up pretty quickly it during the process of working every day. So I would just say, oh, I've noticed, I know this doesn't fit here properly, or you don't seem to be able to get comfortable in this position anymore. So I think in general conversation, we would bring it up, or if it's a biggie, we do have regular sort of talk sessions, and I would mention something then, and we compare notes to see if we're both thinking the same thing. So I don't think I'd ever make it a big deal. It would just be something we talk about all the time,
Yeah,
change. So yeah.
that's fabulous. Sarah, did you want to add anything to that, or should we go to the next question?
What does that, which Sue does it instinctively, is bringing up things with sensitivity, sort of not, on, is the language can be important, so it's not just like, I've noticed you got worse. Not as direct as that. But, there's a way to mention it, and also maybe at the right time. I mean, as Sue said, we have our regular chats, and also there's points in the day when there's a good time. But if I'm just going out the door or, in the middle of something, that wouldn't be the right time. So sensitivity, it's time choosing, I would add.
Fantastic. The next one we've had come through is, as my employer's health needs change, I'm not sure how to balance their wishes for independence with ensuring they stay safe. How do other PAs and employers manage this?
Hmm.
I'm not sure. Again, just I would communicate, I think, and ask you, it's if you were willing to I if you were willing to try something, Sarah, if I was concerned that it wasn't safe, I would just say that to you. Have you thought about um this aspect or that aspect? And you could if you almost certainly will have thought of everything, and I would be happy to proceed if you were happy to proceed. Does that make sense? Like, what do you
Yes.
think, Sarah?
Yeah, no, I think you're right. And I know I can think of occasions when maybe you've prompted prompted me to think about something, um, and then it helped me come to that decision that perhaps it would be best to try it a different way first. I can just think of cutting my fingernails. I used to be so stubborn and wanting to do that myself. But then, I was in day. I could have stabbed myself in the arm or if I'd slipped because I was balancing so precariously. And that's a risk that I shouldn't really take because it just takes one split second and I could have injured myself quite badly. So I think it's having common sense, isn't it? And knowing the person.
I
Yeah,
You
agree.
always welcome suggestions. Don't have to take them on board. But if they're delivered with, that's not telling me what to do, but sort of trying to assist me, then I always welcome that.
Yeah. I think also it's really important for PAs to remember that there is such a thing as positive risk taking. There is, there is sometimes it might not be really
Mm,
perfectly in every way safe, but it's potentially a really important sort
mm.
of, I don't know, maybe life event or part of it's just something really important, like on your bucket list.
Yes,
Mm.
we were talking about this earlier, weren't we?
Yeah.
About the, when I went on a cruise. Do you want to tell it from your perspective?
Shall I? Yeah. So it was we'd hopped off the cruise ship and you had planned a bus tour. And I was quite rattled about the thought of getting you safely on a bus, securely parked on the bus, and then enjoying the tour. I was quite worried that it would be dodgy, dangerous for you, and I just couldn't imagine it. And I influenced you with my worries. I said to you, "Are you sure this is a good idea?" And I realized that in doing that, I had put a worry into your head that wasn't there. And I had to give myself a smack and say, now let's give it a go. Let's give it a go. And we did give it a go, and it was brilliant, and it was perfectly safe. And it made me really realize that if you are up for it, let's do it and worry. If there's a hazard that makes itself known, we'll deal with it and avoid it if it appears, and that I mustn't influence you. If you've decided you want to do something and you've looked into it and found out everything you need to know, we'll go and do it. And I won't try and change your mind on that. We'll worry about problems if they appear, not
Yeah.
if they might appear.
Hmm.
That's fantastic. That that's exactly how you want to go into these activities or tasks or whatever it might be,
Mm,
is just we'll handle it if something needs handled. But life of doing these things is fun, and I think especially when you have a condition that is going to deteriorate to the point that perhaps maybe you aren't as able to get out and about. So you want to really seize the day and sort of
mm.
do those things while you can. I think that's fabulous. Right, next question. My employer is accustomed to being in charge and sometimes struggles to accept support. How can I respect for their authority while still doing what's needed?
I don't know if that really applies because I don't think you there's ever a struggle for power with we work together all the time on everything. So and again it's that balance between what Sarah feels she's able to do and allowing her to do it. So I wouldn't ever, I don't think, I wouldn't come across that problem, I don't think. So
No.
No, I don't think anyone's go over steps, or if they find themselves wanting to, if then we've had a conversation about it, about whether it's appropriate. Like I said before, a lot of it's instinctive. There have been times when I've needed someone to take charge of a situation because when I am low in energy and maybe my breathing isn't as good, like the nature of it is that I can get a sudden CO2 headache. My decision making skills can go totally out the window at those times. And then that comes from them knowing me and the sides, and then knowing when they might have to actually step up and take charge, deal with a tradesman in my house, that sort of thing.
Yeah.
Uh, but that's the it's that building the trust and the partnership thing, um, which can take a while.
Yeah. Fabulous. Thank you. I'm just reading through these questions to see which ones are the most relevant. Okay. Sometimes my employer sees accepting help from PAs as a loss of control. How can I frame my role so it feels like a partnership rather than a dependence?
Um,
Can I can I start with music for voiced as an example? So when we got the ceiling track voiced, we I think I was struggling to accept that things had got to that stage where it was needed. Uh, but on the other hand, I knew that we couldn't carry on struggling the way we were, and that was a safety issue for both me and for you and the rest of the team.
Mm.
Um, I think we all found it a tricky time, but you, well, all my peers helped me to see it as a good positive. Um, and it did take time. It did take longer to start with. But that, I think, in my years of being an employer, has been perhaps the biggest, most reluctant change that I've dealt with. What do you think about that situation?
yeah, I think that's a really good example, um, because it's easy to struggle on, doing things that you know how to do because they're safe and easy. I think stepping into something new for you is, well, must be quite scary to, like you said before, there's a certain amount of trust, isn't there? I think that is quite crucial. The trust that you have in me is that if I suggest something, a change or something new, that you'll listen to me because you know that I know you. So when you have a new piece of equipment like that, it's quite nerve-wracking for all of us, really. We've got to learn how to use it and learn safely, and you've got to use it yourself, which means you've got to allow us um, to do what we've been trained to do. Um, so yeah, I think that's a good example.
I think within 2 or 3 months, we were all saying, "Oh, isn't this wonderful? This has changed things greatly for the better."
Yeah,
Um,
yeah.
but
It's taken.
it was just getting to that shifting point. But you just have to embrace the changes sometimes. And although it might seem difficult to begin with, the, there's usually a good end to it, if it's the right change, that is.
Yes, definitely.
Brilliant, thank you. I've got another question. Due to my employer's changing needs, we as their PAs feel they now need a double up for personal care and transfers. How would you as a PA go about bringing that up to your employer that perhaps they need more support?
I suppose that would come down into the training that we've been given, where it's a lot of that would be a health and safety issue for the PA, because again, you could struggle on, um, but that's how you end up hurting yourself, and it might not be an obvious immediate injury, it'd be a long-term strain. So I think that point is probably it's your duty to speak up and say, I'm afraid of hurting myself doing this. Um, I think it would be easier with two people, um, and just having that conversation.
I
I
think
think.
I think we have had those discussions in the past, and now I do have extra hours built into my budget for those sort of days. But I think it just evolved, didn't it? Because we all came to the conclusion that everyone benefits from that because things are quicker, for me because there are two people, so I might be in an awkward position for less time because there's an extra pair of hands to support my head or whatever it is doing. And yeah, we can get, say, if I'm using a changing places facility, we can get in and out in shorter amount of time, and I'm more comfortable, and my PAs could feel happier as well. Um, but yeah, that is quite a thing to realise. But then you have to work hard, not only as a, a, an employer, but as an employee to make that work. You know, if you've got to work with another person, or if I've got to coordinate one person, it's two people instead of one, you know, it's another dynamic there, but you just, you know, it's that realism again, and being practical about what needs doing and how it needs doing.
And I
I
think maybe if, as a PA, if you're thinking, oh, this is too much, I need help, I think perhaps you could suggest a trial. Can we try, could we try this one day with, let's say it's a long day out. Could we try this with two people next time? Because I'm really tired, or, it's quite a lot of hard work. Just to suggest a trial day out with two. So somebody does part of the day and then somebody does the other, and to see how it goes. I think trying things out has shown us lots of different ways to do things, hasn't it? We're
Yeah,
not scared of saying, should we try this like this? And that has helped us quite a lot, I think.
I think we all have different ideas as well to bring to the table.
Mm.
Um, and I was just thinking about it is also practical on other levels because if we were out for the day and when, when somebody with me became ill, got a migraine, which has happened in the past, we just had to pull over on the motorway because there's only one person with me, and we just had to deal with it in the moment. But there's that as well. There's those contingency plans if, you know, somebody did struggle, or if, you know, you don't know what's going to happen when you're away from your home environment. So we've learned that over the years.
That's brilliant. I think I'll make this one our last question.
Mm.
Sometimes my employer doesn't tell me when they're struggling because they don't want to bother me. How can I build more open communication?
I'd say I've been guilty of this in the past, not so much now. Um, so do you feel you're able to bring things up if I haven't vocalized it directly?
Yes, I think I know you, and that comes down to working with somebody for a while. I think I think a little example I could give is would be if you had some cover to offer and you were hesitant, not knowing, because we all have family lives and what have you. And I know sometimes you might be, I don't want to put pressure on that person to take that cover, but I do need cover. And I think if I know you well enough, and I might say, do you need that covering? Are you just offering it to me? Like, and then you can say, well, I am having trouble covering it. But I sometimes have to, or I have in the past had to sort of know you and say, I know you're being polite. You're not saying, I really need help here. I know you, and I'll say, do you really need that covering? And then I can say, yes, I can do that. So sometimes I think knowing somebody really well would be the key, wouldn't it, to um, reading between the lines a little bit when they perhaps somebody won't ask you for the help that they really need, or just presenting a little solution, sort of saying, "Oh, can I help you with that?" Or "Are you struggling with that?" maybe it would help if I did this or that. Just, um, I suppose knowing somebody is key.
Mm. I don't think you ever phrase things in a way that I'd feel that you're interfering or taking over. And
Mm,
I'd say that's quite important to strike that balance. If
mm,
ever PA wanted to um, bring up a particular subject, um, it's more of a let's talk about this.
mm,
But this well, at the end of the day, you do what you feel is right. As if, as I have the choice.
mm. And also, I think from my part, just reinforcing to you that that's why I'm here. That's why I'm with you. That's why I'm your assistant. I'm here to assist. So I think maybe a reinforcement of that, here I am. Put me to good use. Um, point me at what you need help with, and I'll get on and do it. Very happy to do it.
Yeah,
I think you just got to make it really open. Here I am. I'm here. I'm here to do these things. And the working together thing. It's not about me doing stuff for you. It's like when we talk, we always talk about how are we going to do that?
mm,
How are we going to get there? How are we going to um, think about that? Or it's always us, isn't it? It's a team thing, and I think that's probably a good angle to look at it from.
yeah.
No, that's absolutely brilliant. Thank you so much. I will turn off the recording now.